So real-time symptom management improves adherence by making sure that the patient stays on the therapy and that symptom is managed in a proactive manner as and when it occurs. And as and when it occurs, it's reported back to the physician so the physician can proactively manage the care of the patient. As for example, the patient might have nausea and persistent nausea, and as a result, he's dehydrated. When he's dehydrated, if the doctor finds out about his dehydration on a Friday, then he doesn't have his office open on a weekend. If I'm an OCM practice, for example, then I'm going to end up asking the patient to go for hydration, which would again increase my OCM costs, and I would rather not do that. If I proactively managed his symptom and I knew that, okay, his diarrhea or nausea has been going on since Wednesday, then my staff would have been intervening the patient, bringing him in, getting him hydrated before the weekend so that there's no issue associated with it. So that's how you manage adherence. At the same time, the adherence education needs to happen when the patient gets the medication. What is happening in the current scenario is you don't know when the RX gets filled. The doctor sends a prescription and the prescription goes to whoever, either it goes to the SP or goes in their own office, and they don't know when they actually got the prescription, so they don't know. By the time the patient gets the medication, the patient forgets about the education he got, because when the prescription is given, the education is given in the office by the doctors. But then when the medication comes in their hand, they've forgotten all their things. Now they have diarrhea and the symptom persists, so you need a technology to cover all that. How do you get that technology to help with that? So you have patient education for each drug associated and in their hands. Then you have patient-generated data, which is the remote patient monitoring, and you have an adherence reminder, medication reminder platform, a technology platform that we have built that helps connect all the dots right from the pharmacy to the physician to the patient, so we know when the prescription gets in the patient's hand. We get that data from their claim adjudication information. Now we know the patient's got the medication. Our case manager picks up the phone, talks to the patient, says, okay, you got the medication, this is what you're going to expect, gives them where the education is on their app, on their computers, wherever they need to go to get the information for that medication, which they have already received from the doctor's office too. But this is again another enforcement of what they need to do. Following that, you now have someone calling them on a weekly basis to see how are you doing. Are you having any symptoms? Now you're proactively managing the symptom, not only just the technology. You can have technology by itself, but patients become dormant with the technology. You have to have someone hand-holding them and a human touch associated with that patient to deliver adherence in a true manner.